With the first vaccines making their way to Indiana, we're hearing from state and federal officials on the best way to distribute the vaccine. This week, we'll talk with Congressman Larry Bucshon, Andre Carson, and Jim Banks, plus a final farewell from Representative Susan Brooks, and the latest on the presidential election, with the Electoral College set to make things official tomorrow, even as Indiana's current Attorney General and next Attorney General weigh in on the last-minute legal wranglings. It's all ahead this Sunday in Focus. More than a month after the presidential election, tomorrow Joe Biden's win becomes official as presidential electors meet in state houses across the country, including here in Indiana. We'll talk about that with our panel. Plus, Congress kicking the can down the road at least a few more days, facing a deadline to avoid a government shutdown as lawmakers continue to negotiate another coronavirus relief bill. All this on another momentous week with vaccines now making their way across the country. Here in Indiana, we continue to see mounting case numbers and continued rapid spread of the virus.
The state of Indiana, when you talk about counties being red, the state of Indiana is on fire.
The steps being announced today are absolutely necessary as the pandemic tightens its grip on our state. I certainly share your belief that we are in a place that none of us want to be, and I want to.
And this morning, we start with the coronavirus crisis. Indiana now in the first stages of its vaccine distribution plan for healthcare workers and others on the front lines, while we continue to see rapidly increased spread. Zach Myers has more.
After weeks of warnings from state and federal health officials,
it is exactly what they forewarned was going to happen.
Indiana saw the highest per capita COVID-19 infection rate in the nation for the week after Thanksgiving, a daily average of 1,025 cases per 1 million people, according to the COVID Tracking Project.
No, I'm not surprised. People they're still out and about, hoping that if they, continue to live their life, this too shall pass, and it's going to take some time.
We actually were seeing that trend before the holiday. We were kind of creeping up in the rankings, if you will. Not that this is really a competition that we want to win.
Some local health officials believe the high numbers are the result of pandemic fatigue.
What's happening is I think some people have let their guard down, not only during Thanksgiving, but even prior to that.
We have to continue to social distance. We have to continue to wear masks. We have to continue to practice safe hygiene. I know it stinks, it does. Everybody's tired of hearing it.
The Regan Streif Institute says Indiana hasn't seen the height of the post-Thanksgiving surge yet, and the state could be on pace to see 7,000 deaths by the new year.
We would anticipate seeing increasing numbers of cases in the next couple of weeks, along with more hospitalizations and, frankly, more deaths.
Meanwhile, several Indiana counties are watching their positivity rates continue to climb. Reporting in Johnson County, Zach Myers, Fox 59 News.
All right, Zach, thanks. This week, we also heard news that Indiana's Speaker of the House, Todd Huston, has tested positive for the virus. He's home recovering, dealing with mild symptoms. This as Governor Eric Holcomb adds new restrictions as state officials begin the process of distributing that first shipment of the coronavirus vaccine. Kayla Sullivan has more.
By the end of next week, 50 Indiana hospitals will distribute the initial doses of the COVID-19 vaccine. IU Health Methodist will be one of the first.
We're ready to go. So as soon as that vaccine hits the door, we will begin administrating. So it's exciting news.
IU Health now has an education campaign for those who will be first in line to get the vaccine, including hospital workers and those in long-term care facilities.
What the vaccine is, how it works, how this mRNA technology works, and even really discuss the history of vaccines.
Indiana is expecting to get more than 55,000 doses of the COVID-19 vaccine next week.
I'd like to have a lot more, but I understand we're dealing with a set volume or a set approved production, and that's going to be shipped out to all over the country.
Holcomb emphasized more shipments are expected in the following weeks. We would need 400,000 doses just to vaccinate Indiana's healthcare population. Though the pace for this vaccine is historic, it's not the first mass vaccination campaign.
President Kennedy did sign into order another mass vaccination campaign related to polio. I'm not having to deal with the debilitating effects of polio or smallpox today, because there was a great vaccine available to me.
That's the goal for this COVID-19 vaccine.
And we do want the public to know that those in the healthcare are really reading this, reviewing this. We're really encouraged by the safety and efficacy data that this vaccine is showing.
Indiana leaders are asking for your patience. It's unknown when the general public will get vaccinated, but the state says it hopes everyone will have the opportunity by next summer. From the Indiana State House, I'm Kayla Sullivan.
And as for the state's rising case numbers, Democratic Party Chair John Zodi responding to the governor's comments that our state is, quote, on fire. He said it appears Governor Holcomb finally has gotten his act together, but to use his own analogy, Zodi says Holcomb is bringing a bucket of water to a house fire. He says Indiana is on the verge of becoming the hotspot in the country. All this as